Now, one of the things that I often see in severe cases of carpal tunnel syndrome, it's atrophy or depression of the APB muscle. That is this muscle right here. Now, when this muscle gets completely depressed or you develop atrophy, this is not something that happens in 6 months. This is about at least 10 years in the making. But somehow the internist that sees this patient every 6 months, at least for a physical examination or for a physical, or even once a year, kind of just miss this diagnosis. Now, all the internist has to do is once they see a depressed APB muscle, this muscle completely gone here, is send the patient to a neurologist, physiatrist, or an orthopedic. That way they can get a proper clinical examination so they can establish a good clinical diagnosis. And the test of choice, of course, is a nerve examination. The nerve examination will be able to stimulate the nerve. We use electrical impulses to stimulate that nerve, and we'll be able to see the speed of the nerve, the shape of the nerve, the amplitude of the nerve, which is the height of the nerve, and we'll be able to see if that nerve it's either mild, moderate, or severe. But for sure, once that muscle's gone, that patient is going to have severe carpal tunnel. So it gets me a little bit upset when I see these type of patients because, again, like I said, it's not something that you develop in 6 months. It's something that happens within 10 years. So if you have been diagnosed with carpal tunnel, just pay attention to the APB muscle. You want to be able to do the proper exercises. Whatever you do, you don't want to bend your wrist. What happens is the nerve here is very superficial. I can make an incision and I can pull out the nerve. So you don't want to bend your wrist. When you drive, you don't want to bend your wrist. When you sleep, you don't want to bend your wrist. You always want to keep your wrist straight because then you can injure that particular nerve.